I am Kirsten Bibbins-Domingo. I'm professor and chair of the Department of Epidemiology and Biostatistics at UCSF and also the Lee Goldman Endowed Professor of Medicine. I am also the Vice Dean for Population Health and Health Equity in the UCSF School of Medicine. Our office seeks to advance and elevate research, education, and programs at UCSF that address the issues that challenge the health of populations. And we want to do this in a way that achieves equitable health outcomes for all of our communities. We do this work in strong alliance with our clinical partners, our community partners, and our public health stakeholders. We are thrilled to be launching this three-part speaker series on what the Lancet has deemed the greatest threat to global health in the 21st century, climate change. Indeed, this is an unprecedented time where health at every stage of life, from birth through childhood and onto adult and older age, is being shaped by the climate crisis. In California, where we are on the front lines of the climate crisis, these effects are already being felt acutely, particularly among vulnerable, marginalized communities who not only bear the brunt of climate exposures like heat waves and air pollution, but are also denied the resources and social and political capital to prevent and adapt to their effects. Climate change and health inequities thus both share a root cause in the unequal distribution of power and resources, which help to drive the disparities in the social determinants of health. Climate action, therefore, represents a tremendous opportunity to reduce health inequities and improve health, both in California and beyond. Through this series, we hope to engage in a conversation about how climate change intersects with health and health inequities and the role of the health professional and academic medical centers such as UCSF in addressing this profound challenge. This series is being co-hosted by UCSF's new Center for Climate, Health, and Equity. I also want to thank our collaborating partners on this series, the UCSF Earth Center, UCSF's Office of Sustainability, and the UC Center of Expertise in Planetary Health, as well as our planning and our advisory committees for this series. We'll now hear from Dr. Sheri Weiser, who is chairing this series. Dr. Weiser is a professor and internist in the Division of HIV, ID, and Global Medicine in the UCSF School of Medicine and founding co-director of UCSF's new Center for Climate, Health, and Equity. She is a leading international researcher on food insecurity, social and structural drivers of the HIV/AIDS epidemic, and more recently on the links between climate change, food insecurity, and infectious diseases. She has also been spearheading educational initiatives across UCSF and the UC system to incorporate climate change and sustainability into health professional education. She will introduce our first session on wildfires.
Thank you very much, Kirsten, and a warm welcome to everyone. We are thrilled to be launching this series on climate change, which is unquestionably the biggest existential threat of our lifetime. The good news, though, and I think the reason that many of us are here today, is that acting on climate change really could be the greatest global health opportunity of the 21st century, and the health community has a vital role to play here. This lecture series is aligned with the upcoming launch of our new Center for Climate, Health, and Equity that Kirsten mentioned, which I will be co-leading with Dr. Ranyee. Our goal here is to advance equitable and just climate solutions that promote both human health and a healthy planet. Our mission is to really harness the expertise of the healthcare sector to drive ambitious climate action for health and health action for the climate. And we're going to do this through 4 pillars. So first, for research, we're going to establish a solution-focused body of evidence on climate health pathways and interventions and encourage multidisciplinary and cross-UC campus collaborations. For education, which is our second pillar, we're hoping to build a world-class education hub on climate and health, really for all health professionals, and this includes our community stakeholders. Third, for health systems, we're working to advance both climate medicine and sustainability in our patient care settings and to build climate resilience in the face of local climate health disasters. And finally, for policy, we hope to make our climate work actionable by translating evidence and best practices into effective policy and patient care. And while we're starting this work at UCSF, we hope to eventually make this a UC-wide initiative. Today's session is the first of a three-part virtual speaker series that Kirsten and I are co-hosting, with the goal to try to bring together our community working at the intersection of climate change, health, and equity. So at each session, we're going to be hearing from leading experts who will be examining health risks of climate change, how climate threats can exacerbate existing health disparities, and importantly, policy responses and solutions. And this includes our healthcare sector's opportunity for action. So for our April 15th session, we're going to be looking at the interconnected and compounded health effects of climate-driven food insecurity and migration. And at our final session on May 20th, we're going to discuss how we can capitalize on the synergies we're seeing between the climate, racial, and health justice movements. So today we're going to be exploring the urgent threat of wildfires with a focus on California. And we know that there are bidirectional links between the hotter, drier conditions that fuel the larger and more intense wildfires we've been seeing and the release of global warming gases from the fires that worsen climate change. And there are many acute and chronic health consequences. So the immediate impacts can include burns and other injuries, death, and psychological trauma. Also, exposure to the fine particulate matter in wildfire smoke and ash, which we know can actually travel hundreds of miles from the fire source, is linked to respiratory and cardiovascular disease and premature death. And the long-term consequences include poor mental health and exposure to chemicals and toxins, which are initially released by the wildfires, but then collect in our soil and water sources. And also displacements due to wildfires, which we know included tens of thousands of people last year in California alone, can then drive poverty, persistent homelessness, and healthcare disruption. And while no one is immune from these impacts, as Kirsten mentioned, certain populations are disproportionately and unfairly burdened. For example, Indigenous and low-income communities may be forced to settle in fire-prone areas and then may lack the resources to protect their property and evacuate. And we know that wildfire smoke can exacerbate the health problems for communities of color who are already disproportionately impacted from the negative health impacts of air pollution due to environmental racism. And finally, incarcerated individuals can constitute up to 40% of the crews that fight wildfires in California, which really raises ethical questions given the health consequences of this work. So today, I think we have a fantastic panel. We're going to hear three short presentations, followed by a panel discussion moderated by Dr. Gina Solomon. And then we'll get closing remarks from Dr. Talmadge King, who is the Dean of the UCSF School of Medicine. And our speakers and panelists do bring quite diverse perspectives. So Dr. Marshall Burke is going to start us off by giving an overview of the causes and societal consequences of the growing wildfire burden. Then Dr. Stephanie Holm is going to walk us through the health and equity impacts of wildfires, and particularly for vulnerable populations. Then Ashley Conrad-Saydah is going to offer us a forest management perspective and describe how we could build wildfire resilience through interdisciplinary and nature-based solutions. Then Dr. Ranyee Chiang is going to join us for the panel discussion where she can really speak to the urban health impacts of smoke and also possible policy responses in the Bay Area. And finally, Dr. Richard Jackson is going to round out our panel and provide insights into the larger public health and policy responses that are really needed to reduce the health impacts of wildfires. So before I introduce our first speaker, I encourage you all to ask questions through the Q&A tool in Zoom, which you could find at the bottom of your screen. And after three presentations, we're going to have just a few minutes for clarifying questions before our panel discussion, and there'll be more time for questions during the panel discussion. So now I'm going to introduce Dr. Burke. Dr. Marshall Burke is an associate professor in the Department of Earth System Science and Deputy Director on the Center of Food Security and the Environment, and a Center Fellow at the Freeman Spogli Institute for International Studies at Stanford University. His research focuses on understanding how changes in environmental conditions affect a range of social and economic outcomes. And he'll be giving us an overview, as I mentioned, of the drivers and consequences of the accelerated wildfire activity we've been seeing in California and beyond. So welcome, Marshall.
Great, thanks a lot, Sheri. Really appreciate the invitation to come be on a panel with such a great group. So I'm sort of the setup guy. I'm going to give some background information and look at some quick data on the growing risk and burden of wildfire. And I'll do that in a few slides. Share them here. All right. Hopefully everyone can see that. So I should start out by thanking a number of colleagues listed here at the bottom at Stanford and in the UC who have contributed to this work. And this is a really interdisciplinary group, and our work, as I'll show you, is really trying to think about not only the underlying drivers of why we've seen such a large increase in wildfire risk, but as Sheri mentioned, then to draw the pathways to the outcomes in the world that we care about, the health and livelihood outcomes in California and around the country. I'm starting here with, I don't know if you've seen this photo, sort of an amazing photo from a few years ago. You know, these gentlemen in shorts in the front here are golfing as the world sort of burns behind them. This feels like a parable, so it's a great starter slide. Okay, so where are we? I think anyone who lives in California, or really anywhere in the West, at least intuitively understands these data pretty well. We have seen wildfire risk grow substantially over recent decades. And in California, 2020 was by far the largest wildfire year, at least in terms of burned area, that we have experienced on record. So there's a lot of year-to-year variation, as you can see, and that underlying variation tends to be driven by weather, by year-to-year changes in climate. But overall, the trend is inexorably up. It's continued upward quite strongly, at least since we've been collecting data. Okay, why is that happening? There are two underlying reasons. One is a very slow-moving reason. Another is a fast-moving reason. The slow-moving reason is a century of fire suppression. We have been used to putting fires out when they start, and that has led to an accumulation of flammable material in our forests and our grasslands. So that's the slow-moving cause. The quicker moving cause is the rapid changes in climate that we've seen over the past few decades. And that has led to multiple things happening in our wildlands. Fuels have become much more flammable over time. In the middle plot here, you can see measures of fuel aridity over time. Again, there's a lot of year-to-year variation, but the overall trend has been pretty substantially up. We've seen increases in what's called fire weather. So this is the coincidence of multiple conditions that are associated with very high fire risk. This tends, again, to be dry weather, hot weather, and windy weather. Again, these are growing quite quickly, half a standard deviation per decade increase in the conditions that cause wildfire. And nice work by a range of folks have shown that these different measures, just based on meteorological conditions alone, are very strong predictors of the amount of burned area in a given year. So again, changes in climate, particularly warming conditions that dry out fuel and make it more flammable, are the big underlying driver in the recent increase in wildfire that we've seen. So 2020, of course, was a historically bad year in California. This on the left, you can see a sort of in September when the fires are really going. This is a measure of the energy release component. Think of this as sort of a summary measure of the fuel moisture, the flammability. And this was at an all-time high across the West. We were just set up for a really bad fire event, and we got really unlucky with a lot of lightning strikes in August that really set this event off. And again, when you zoom in on California here, this other measure, this energy release component, has also trended up substantially over time. And research suggests that it will continue to trend up in the future. So various estimates suggest that as fuels become more flammable and temperatures warm, burned area could roughly double over the next 20 or 30 years. So 2020 might just be a taste of things to come. Okay, So what are the implications? I think there are a lot of implications, and the panel is really going to speak to these. One I want to think about briefly, and one we've worked on from an exposure setting, is in thinking about air quality. So it's important to look at the background data on key pollutants in the US. And here I'm focused on PM2.5, particulate matter. And this has really been a success story, at least until the recent years. We've seen dramatic, largely policy-driven improvements in air quality across the country. Steady improvements in air quality in all regions, steady declines in key criteria pollutants. But if you sort of look hard at the more recent years, these trends have actually flattened out, and especially in the Western US, these have started to reverse. Now, 2020 is not on this plot. 2020 would actually be quite high in the West and Northwest. But at least through 2019, you could already see this flattening out and potentially this reversal. So we've looked at this carefully and actually have calculated that wildfires are accountable for a large proportion of this reversal. So on the right here, you can see our estimates of the predicted percentage of PM2.5. Again, this bad air pollutant that we really care about. The predicted percentage of PM2.5 that's attributable to wildfires has grown from roughly 10% across most of the US to upwards of 40 to 50% in the last few years. So PM2.5 is starting to dominate, at least in some years, our poor air quality measures, right? And really putting upward pressure on an otherwise very good air quality story over the last 2 decades. Here are some maps of the smoke contribution to overall PM2.5. Again, people think about wildfires as a problem in the US West, and that's certainly the case to some degree. It was more the case about 10 years ago. But what we've seen recently is you get large fires that start in the West, but then spew smoke literally thousands of miles across the continental US. And what we find is that leads to measurable increases in ground level PM2.5, hundreds or thousands of miles from where the fires actually occur. So this is not just a burden in the Western US. This is a burden that's going to be felt increasingly across the continental US. Okay, 2 more points to make. As Sheri noted, one thing many folks are quite interested in, our group is certainly interested in, is who is exposed to this? Are there important disparities in exposures to wildfire risk? So on the left, this is not wildfire smoke, this is overall PM2.5. And these are the sort of average disparities that we're used to thinking about. So different ways to look at this information here. I'm plotting average PM2.5 as a function of, at the county level, the percentage of non-Hispanic white people as a proportion of the population. So white populations, as we know, tend to be less exposed to PM2.5 on average as compared to other groups. Interestingly, for wildfire, it seems to be the reverse. White populations, non-Hispanic white populations appear to be more exposed on average to wildfire smoke. Again, this is ambient exposure. This is outdoor exposure. And so what we need to think about then is these ambient exposures could be different from the typical sort of disparity pattern that we look at. But what really matters, because we spend so much of our time indoors, particularly during a pandemic, I don't have to tell you that, we're just in here on Zoom all the time. What really matters is how much of that stuff gets into the house. And so we're working on this and using a range of sensors, including here I'm showing purple air monitors where people have both indoor and outdoor monitors. And what we can distinguish is amazing differences in the amount that a given change in outdoor air pollution infiltrates into people's houses. So here I'm showing you purple air monitors around the Bay Area in California, where we are. The top here is the outdoor PM measured during these really bad fires we got in August and September. And the bottom plot is how that outdoor PM infiltrated into indoor. And so here I'm distinguishing high infiltration households in red versus low infiltration households in blue. So in half of our households, air pollution shot up during wildfires and led to incredibly hazardous indoor PM2.5 levels, right? And so now we're working to understand, okay, can we characterize these households and understand what makes them different? What makes the high infiltration households different than the low infiltration households? And already it looks like this is pretty strongly predicted by household and neighborhood specific characteristics that matter for the disparity stories that we want to tell. So we need to think about ambient exposures, but we really need to think about how this stuff gets into people's houses to understand the disparities and then understand the downstream health impacts. So I will stop there and look forward to everyone else's presentations. Thanks.
Thank you very much, Marshall. That was excellent. And next, we're going to hear from Dr. Stephanie Holm about the health impacts of wildfires and particularly smoke exposure. Dr. Holm is an assistant professor in the Division of Occupational and Environmental Medicine in the UCSF School of Medicine, and she also co-directs the Western States Pediatric Environmental Health Specialty Unit, where she helps advise on how to reduce wildfire smoke exposure for children. Welcome.
Thank you, Sheri. So as Sheri said, I'm going to be speaking about the health effects of wildfires. I'll talk about adults and children and vulnerable populations within those. And as a pediatrician, focus quite a bit on children because they are particularly vulnerable to wildfire smoke exposures. I, as Sheri said, work as part of the PACU. I actually also work at Cal EPA. And so my sort of standard disclaimers is that, my comments are my own and not official stances of any of the various organizations that I work for or receive funding from. All right, so I'm going to talk briefly about what the health effects of wildfires are, what the health effects of wildfire smoke are, why kids are particularly vulnerable, and then what we know about wildfire-specific smoke effects in children. So this was mentioned sort of briefly in the intro, but there are quite a number of health effects specifically from wildfire events. More than 3,000 people per year die related to wildfire events in our country, and there's more than 15,000 injuries. That includes things like burns and other acute injuries that occur while people are fleeing fires every year in our country. There are also substantial mental health effects. There's some really great work out of Canada and out of Australia looking at mental health effects following wildfires. There's a group that has extensively studied a population of youth, for example, in Fort McMurray, Alberta, up in Canada, after a wildfire event, and showed that there were substantially higher rates of mental health issues, both in terms of symptomatology and also diagnoses of things like PTSD in the years following a big wildfire event, and that those actually persisted for quite a couple years out in those kids. There are also some groups in Australia that have shown that the mental health effects of wildfire events, similar to other sort of disaster events, seem to be worse in folks that have more pre-existing stressors. I don't think that's surprising, but it's a good reminder of the fact that these effects are particularly felt by populations that are already facing a number of other stressors. And then, of course, displacement can have substantial health effects. That can include exacerbation of underlying health conditions as folks have trouble, continuing medications that they were on regularly as their life is entirely disrupted. And of course, this is particularly difficult for families of limited means. It's extra hard to recover from these events that can really take away a lot of people's, life, the entire life they've built. When you're really living paycheck to paycheck, it's really extra hard to recover from that. But I do want to really focus on wildfire smoke effects. And the reason for that, as actually sort of briefly mentioned by Dr. Burke earlier, is that you can have fire events that create smoke plumes that affect a much wider population than is affected by the fire and the sort of the displacement itself. So this is an example of a satellite image taken, I believe it was October 1st of 2020, when a number of those various complexes were burning last year. And while there were a number of individual fires burning and plenty of folks being affected by those specific fires, you can also see that really nearly the entire state was blanketed in smoke. And so we've got just sort of another order of magnitude of people affected by the smoke effects. So what do we know about wildfire smoke health effects in adults? There are very consistent findings that respiratory illnesses of all sorts are tightly related to wildfire smoke exposure in adults. That includes sort of lots of different ways of measuring that, whether you're looking at hospital visits, ER visits, exacerbations of underlying diseases, lots of different measures. Those with pre-existing respiratory disease are definitely at higher risk than healthy adults. There's also consistent increases in mortality in adults. That's particularly, of course, in the elderly, and especially respiratory mortality, consistent with the respiratory findings I was just discussing. There are also a number of studies that have found increases in cardiovascular events of different sorts, things like heart attacks, and visits to hospitals and ERs and such for cardiovascular diagnoses. Those findings are a little more inconsistent than what we know about respiratory disease at this point. So definitely an area that still needs more work, but certainly that's a relationship that has been found in some studies. I mentioned earlier that children are particularly vulnerable. That's true really in regards to a lot of exposures, most environmental exposures, but for wildfire smoke specifically, I want to talk through why that's the case. So I like to think of a framework of 3 reasons that children are more vulnerable. One is that they have differences in their physiology that increase the dose that they get. The second is that they have unique windows of development. And the third is that they have behaviors and preferences that increase their exposure. So for wildfire smoke, those differences in physiology really relate to the fact that children breathe faster than adults and therefore take in more air relative to their body size, sort of relative to their ability to deal with toxins, than adults do. So if you have a baby or a toddler or a young child and me in the same room, they're going to get an increased dose of exposure of any air pollutant, including wildfire smoke, compared to what I would get. They also have unique windows of development. I don't think I have to tell you guys that kids grow and change a lot more than we do. And so, certainly any sort of insult that happens during those periods of rapid growth have the potential to have lifelong effects by disrupting that growth. And then in terms of behaviors and preferences as it relates to wildfire smoke, kids are much more active than we are, which is a great thing, right? My daughter runs around much more than I do. But that also means that they're breathing faster and are therefore able to take in more smoke. They often also spend more time outdoors than we do as adults. We know from other air pollution work that there are a variety of health effects of air pollution generally in children. That includes breathing effects, things like asthma, pneumonias. It also includes effects on metabolism and growth. So, obesity and blood pressure and those sorts of effects, neurocognitive effects, and carcinogenic effects. And that's research that's been done on the specific kinds of pollutants that are in wildfire smoke, things like particulate matter, volatile organic compounds, a wide variety of pollutants, but during non-wildfire times. There's also been a little bit of research that's occurred in children during wildfire smoke events specifically. Most of that has been focused on respiratory effects. So that includes upper respiratory effects like itchy eyes, sneezing, in cold type infections, also lower respiratory effects on asthma, pneumonias, that sort of thing. And a couple of studies have also shown reproductive effects relevant for children, like decreasing birth weight related to wildfire smoke exposure during the period while the child's in utero, as well as an increased rate of preterm birth. So that's a really quick overview. But as I said, we definitely know that there are known health effects related to wildfires for everyone, but particularly vulnerable populations. These health effects from the smoke can really reach a large population, and children are really uniquely vulnerable to these exposures.
Thank you, Stephanie. A very hard task to cover so much material in a short period of time, and you did a wonderful job. And I just want to remind everyone, most of the sort of meaty questions we're going to talk about in the discussion when the panelists are up, but we will have a few minutes for clarifying questions after the next talk. So it's now my pleasure to introduce Ashley Conrad-Saydah, who's a recognized leader in climate change, renewable energy, and natural resources policy. Ms. Conrad-Saydah is founder of the Sowing Change Strategies and an affiliate of the California-China Climate Institute at UC Berkeley. She partners with academic, public, and private sector clients to deliver cross-sectoral solutions to seemingly intractable climate and energy challenges, and she previously served as the Deputy Secretary for Climate and Energy Policy at the California EPA and as the Renewable Energy Program Manager and Presidential Management Fellow at the U.S. Bureau of Land Management. Welcome, Ashley.
Sorry about that. I was in the wrong place. Thank you so much to Sheri and UCSF and all the organizers, and especially to Gina Solomon for inviting me today to join this group. It's a really, I guess, both disheartening and heartening conversation in the sense that we are in the midst of really terrible wildfire seasons, and climate change will continue to make things worse. But I am here to talk about what we can do to address that health threat and to address the threat to our ecosystems and communities as well. So as we have heard, climate change and the wildfires that come from climate change really test community cohesion and ecosystem resilience. In California, our forests are actually meant to be managed by fire. And as Marshall mentioned, we've been suppressing those fires for many, many years, for decades. And so we're exacerbating the impacts because we've already messed with ecosystem resilience. We also know that both urban and rural communities absorb the immediate and long-term wildfire impacts. I think over the last couple of years, we've seen a lot of comments and focus on wildfires, in part because the smoke has impacted urban communities so greatly. But rural communities have been absorbing these impacts for an incredibly long time. And when they absorb these impacts, it's not only the immediate impacts of the fire, but it's the after impacts as well. So these communities see really terrible erosion and potential, as we've seen, mudslides, landslides from fires in the rainy season afterwards. The waterways can be occluded. Their dams can be, silt can build up behind the dams. Their reservoirs can also see a lot of silt build up. It's incredibly costly for some of these small communities to actually improve their water systems after a wildfire. So you see these long-term impacts. As well in rural communities, a lot of people leave. They don't necessarily come back. And so we're seeing also economic impacts and long-term sustainability issues with a lot of these communities. But along those lines, there's actually something that can be done. And there are a number of different policy actions that the state of California is taking, tribal governments are taking, a lot of nonprofit partners and community partners are taking. One of the best ones, though, is actually prescribed fire, which would introduce more smoke into communities in implementing these prescribed fires. The good thing about prescribed fires, though, as you can see here, is they're often very low-lying. The point of prescribed fire is to really take out some of the lower-lying or smaller trees that essentially would crowd out forests and would take resources from larger trees that can withstand wildfire. Prescribed fire is also helpful in potentially removing non-native species or species that aren't really adapted to fire in the same way that some of our species are. And they often happen, or they almost always happen, during the rainy season when there's a better opportunity for the fires not to burn out of control. So there is an opportunity to really address some of these fires proactively and try to improve forest health over time. At the same time, a lot of the types of forest activities that we need to undertake really require rapid policy adaptation. And in the natural resources and forest space, so much of what we do is governed by environmental permitting under NEPA and CEQA. And those permitting processes can be incredibly slow at a time when we really need faster responses, at a time when we need to see these types of forest activities happening in every single rainy season. Instead, sometimes permitting timelines can take many years. It's challenging to get funding directly from agencies to people on the ground to do the work. And it's also hard to know where personnel is around the state and to move them and trucks and all the resources to do this kind of forest health work. So there's still a lot of work to be done. California is doing a wonderful job of funding forest health and the types of activities that can improve communities and forests over time and reduce, again, that long-term smoke and wildfire issues that we're seeing. So there's still, though, a lot of confusion, and many of you, I think, are from communities where you may not know these acronyms, and it's a bit of a word soup. And you can imagine that even within the communities where there's a lot or organizations where people know about this type of work, it's still a word soup. So you have these funded actions on the left, forest and watershed health projects coming from 3 or more agencies, home hardening activities to protect communities that are built into the wildland-urban interface from CAL FIRE, disaster relief coming from both Cal OES, the Office of Emergency Services, and federal emergency management. You have technical assistance for capacity building and supporting communities as they try to actually get through a lot of these permitting processes coming from the Department of Conservation and the Air Resources Board. And then you also have wildfire suppression activities that potentially make things worse, but actually have to happen as a result of fires. And that's coming from a mix of both federal and state agencies. What is underfunded is, or unfunded, are a lot of these sort of broader efforts to coalesce around all of these activities in one landscape. So you might have one organization that has to apply separately to 4 or 5 different agencies to actually develop a prescribed fire or a mechanical thinning or a reforestation management plan. So having proactive local community engagement and planning to really identify the values and needs of communities and then address them through potentially a regional resilience fund would be incredibly helpful. And it's one where we're seeing some action moving in terms of supporting regional funding and regional decision-making coming from the state's Forest Management Task Force and some of the conservancies like the Sierra Nevada Conservancy. What's also underfunded is sustainable economic development and circular economy research. So this idea that when you take wood off of the landscape during these forest management activities, it needs to go somewhere. And in going somewhere, it could actually go to facilities where it could be turned into mass timber used to build buildings. It could go into potentially biomass facilities that are managed in such a way that they're still protective of public health and they're not just burning wood in a different situation. Funding should also go to local NGOs and to tribal support to ensure that those voices are in these proactive local community engagement and planning discussions. And additionally, we really need a wide range of proactive land use interventions that don't just include the ones that we know obviously contribute to better forest health. Finally, we do need to look at a comparison of wildfire cost burdens. There's actually a really wonderful paper that came out of China, one of my colleagues through the California-China Climate Institute, that shows us the true cost of wildfires over time. So let's see, I see Sheri, I just have 1 minute left. So here are some opportunities, projects I've worked on recently. The Nature Conservancy and the Institute put together this look at where you could actually do nature-based solutions in California. The dots here are just the forest-based solutions, but you can look at many others. But this is opportunity where we can invest and improve nature and ecosystems and really improve communities. We also have a project in Tuolumne County that's funded with $70 million from federal funds, but through the state's Housing and Community Development Agency to work on this circular economy idea in the aftermath of the Rim Fire. And finally, there's some work underway right now with the Sierra Nevada Conservancy to think about how you take a pilot project on 2.4 million acres and spread it across all of their WIP geographies, which are Watershed Improvement Program geographies, providing more resilience to about 22 or 23 million acres of Sierra Nevada communities. So there's a lot of work underway and there is a lot of promise. And I think it really will take having all of the data that we've already heard about how to avoid these health impacts and doing putting more and more proactive projects on the ground. And that means spending money, moving personnel to those areas, doing a lot of research and working collaboratively across all of these different sections. So here's my list of what we really need. And I think, this last one is really critical. We need forward-thinking land managers from the Forest Service, from the state of California, and private landowners who are willing to take on prescribed fire and willing to take on some of these bigger projects for the longer term benefits to reduce the impacts of climate change. So thank you so much. Acknowledgements to all of the organizations with whom I work, and also to these kids who we hope will keep having these safe trails to walk on and really beautiful forests for years to come. Thank you again.
Thank you, Ranyee. A treat for us to listen to a very different perspective than we typically get in academic medicine. So thank you. So we're just going to have like 2 questions now, and the rest of the questions that you asked, we're going to reserve for the panel discussion. So specifically, I think we'll reserve a question on risks for elderly and geriatric populations, which is a really important question. And I guess Marshall, or we're going to ask you to briefly comment on whether you could predict which fire-prone forests present risks to specific locations and populations. And this may be something that, or Ashley, that's something you could also address. So I'll start with that question.
I'm sorry, mute. Can give my perspective. Other folks on the panel are knowledgeable about this too. Yeah, so proximity is important and wind direction is important, right? So a forest nearer to urban areas matter, but wind really matters, as you saw in that nice satellite image that Stephanie showed. Like, the smoke can travel very far from distant fires. So I think we could use some better science here, but I think our overall goal would be, if we get large fires in California, it's very likely that those are going to have negative air quality impacts on some population. It might not be in California, but it might be Las Vegas, or it might be Phoenix. So, I think our overall goal is just going to be to reduce the very severe crown fires that we've been seeing.
Great. And Ashley, the other question I have for you is, could you speak about what's going on with PG&E? What would you recommend going forward in terms of regulatory reforms? What are the political possibilities for re-regulating public utilities like PG&E?
I wish I could give a great answer to that, but there was an entire commission on wildfire response and a big group really looking at PG&E. And so there are 2 reports that came out of that, including one from one of Marshall's colleagues at Stanford that I can find the link to and send along. But I think it's such a complicated answer, so I'd rather share reports from the experts.
Great, thank you. And the rest of the question and answers we're going to reserve for the entire panel. So now let me introduce Gina Solomon, who's going to be moderating our panel. Dr. Solomon is a professor in the Division of Occupational and Environmental Medicine at UCSF and a principal investigator at the Public Health Institute. She served as the Deputy Secretary for Science and Health at the California EPA from 2012 to 2018. And before that, she worked as a senior scientist at the Natural Resources Defense Council for many years. She conducts policy-relevant environmental health research and is investigating links between air pollution and COVID-19 severity and the effects of wildfires on drinking water quality. And she's been our partner in crime in much of our climate and health work. So it's a pleasure to have you. And I'll turn it over to you, Gina, to introduce our panelists.
Great, thank you, Sheri. And I really want to thank the speakers again for such a great set of, for laying out these issues in a really wonderful and comprehensive way. Before we go into the panel discussion, I would also like to welcome 2 new panelists, Dr. Ranyee Chiang from the Bay Area Air Quality Management District and Dr. Dick Jackson. So Dr. Chiang is the Director of Meteorology and Measurement for the Bay Area Air Quality Management District, and she leads the analysis, monitoring, and forecasting of air quality in the Bay Area. And she also does community scale monitoring to reduce emissions in neighborhoods disproportionately affected by air pollution. She's been internationally recognized for her leadership and her contributions to the development and implementation of clean cook stove standards. She's a UCSF alum. She completed her PhD in biological and medical informatics here. I also want to very much welcome Dick Jackson. I consider you a mentor, Dick. You're a UCSF trained pediatrician, professor emeritus in the Department of Environmental Health Sciences at UCLA Fielding School of Public Health, and very much a well-recognized public health leader. Served as the director of the CDC's National Center for Environmental Health for 9 years, as the state public health officer, the first state public health officer of California Department of Health Services, then California Department of Public Health, And in these roles, Dick Jackson was instrumental in establishing major environmental public health programs at the state and national levels and has received numerous honors, including the Presidential Distinguished Service Award. So since I have you on and just introduced you, Dick Jackson, let's talk a little bit about what we can be doing as health professionals to address the urgent and growing health threats of climate-driven wildfires. I mean, in some ways, we can't be out there stopping the fires, but what can we do in our own institutions? And Dick, based on your work with CDC and CDPH, what recommendations do you have for public health practitioners and institutions?
One is that we in health, we're 16, 17% or medical care of the GDP of the United States. We have a lot of influence economically in our world, and also socially. People listen to us as long as we're humble and not arrogant and don't bloviate in the process. And sometimes we do. But so one is we've got to use the power of that 16%, the supply chains, the footprint of the hospitals. UCSF is looking at a $3 billion improvement out, and that location, I remember running up and down the stairs from the 6th floor of pediatrics to the 15th floor nursery and back down again because the elevators were so slow, but also the need to rebuild a hospital that's going to work 50 years from now, just instead of the way it worked 50 years in the past. And believe me, our cars will mainly be running on hydrogen and or electricity. Our buildings will not have backup diesel generators when the energy fails. They're going to have to be net zero, and we ought to be building for 10, 15 years from now. Number two, we're a lot of people. We're 10% of the employed workforce of the United States. That's a lot of voters. And you all know about entire elections being changed by a difference of 10,000 votes in some locale or another. And we need to have that voice get out there and to really make the arguments that you've all made that the climate is a health issue. Marshall, I loved your presentation, and you triggered 3 thoughts. And I was going to put up a slide, but the change in pulmonary function tests in children between about 1995 and 2010, the prevalence of children flunking that test was cut in half. Just routine kids in 3rd grade was cut in half by the changes that we put in place and Gina, you were involved with this with Cal EPA and John Baums with the Air Resources Board, of reducing the pollution from our vehicles and elsewhere. But we're now up against a brick wall almost, or a firewall from what we're hearing from marshals. We're not going to continue with that progress unless we deal with fire. And the last one is that the medical care system is about 6% of the greenhouse gases of the United States. And I have heard professors Marshall at, I'll say his name later, but at Stanford, at the Hoover Institution, claiming that we should not be doing independently forging ahead on greenhouse gas reduction in the United States because China's running a huge concentration camp, and they're just going to take advantage of the fact that we're cutting back on our economy. So I'm being very provocative, but not improperly so. I'll stop there, Gina.
That's great, thank you. And I actually, there were so many things that you raised that I'd like to expand upon, and I think this might be a good opportunity to turn to Ranyee Chiang, who works for your agency, is tasked with making our air in the Bay Area breathable. And these jobs have certainly made your job harder. I mean, these fires have made your job harder, and it's particularly an issue for some of the vulnerable communities in the Bay Area. And so, how are you working to try to address this issue with the limited tools that are available, to the agency?
Thanks, Gina. And it's a really good point that you raise. I think our job as part of the alphabet soup of government agencies with the Bay Area Air District. It has gotten a lot harder. I have just a quick slide to show the sorry, I have to click on the right window.
It shows. It's good.
To show just how challenging it has been. This is a satellite loop of last September, where 5 of the 10 largest wildfires in California were all burning at the same time. And this illustrates the point that Marshall was making about how hard it is to predict the smoke impacts from wildfire, because it can go everywhere. In fact, it goes out into the ocean and then comes back. Usually ocean air is clean, and it wasn't this time. And it's making it really challenging for a lot of the models that meteorologists use. The altitude of the smoke is also challenging. On this day, you can see the smoke is everywhere, but it was actually aloft. It was higher than the marine layer. And so the air quality on the ground was actually not as bad as it could have been. So all of these
sky was orange that day, wasn't it? That was the orange sky day. I think all of us remember it.
Alarming orange sky day. So on the question of what we can do, I think it's helpful to start with a little bit of a historical perspective on the role of government in creating these inequities. So for example, with redlining, the federal government, local and state governments, banks and insurers all were part of a racist system that denied mortgages to people based on race and where they lived. And that led to economic inequalities that persist until today. And because of limits on where people could live, that also means many people have been living next to highways, industrial facilities, landfills. So redlining was banned in the late 1960s at the federal level. But if you look at the maps of inequalities in air pollution today, it corresponds with the redlining maps. So I think that's an important context to have in terms of thinking about how we move forward, because there's a lot that needs to be fixed and broken down. So I think there is a role for the government in environmental justice moving forward. With the Bay Area Air District as an example, we are strengthening regulations on industrial facilities, providing grants to reduce emissions, raising awareness. So those are all the things that will continue to reduce air pollution. There are things to reduce the wildfire smoke, but if we can reduce the inequities and exposure to air pollution, I think that will all add up together. I think also Ashley had mentioned the need for making prescribed burns earlier. So that there's a role for us there in that we oversee prescribed burns to make sure there are minimal impacts on local air quality, and we're working to improve that to make it easier for people to do those. And then in terms of, there's still going to be smoke, and how do we protect people from exposure to the wildfire smoke? And so we've worked together, we've worked to get legislation to get funding for clean air centers for people to go to in case they're not able to improve the indoor air in their own homes. So there's an initial $5 million that was authorized by the state legislature to fund these clean air centers, either installing new HVAC systems, upgrading, or providing portable air filtration. And then we're also looking at partnerships with public health organizations in the Bay Area to provide filtration for families who are most impacted by air pollution or already have higher rates of asthma. So those are some of the examples that we're taking as a government agency.
Thank you for that. Really great actions that are practical and tangible for people in the community. I want to turn to a question that came in from the audience from Dr. Robin Cooper, who asked about the health risks to the elderly, to older populations. Stephanie, you talked about health issues to kids, very important. My personal experience, I spent a fair amount of time up in Paradise, California after the 2018 Camp Fire as part of a research project that I was involved in on drinking water quality. And that community, there weren't a lot of kids. There's a lot of retirees, a lot of older people, and the stories that I heard about people, with visual impairments, other disabilities who were trying to evacuate from that fire and survive and drive in the smoke where they couldn't even see, and they didn't have a place to go and didn't have their medications. I mean, the issues were really horrifying. And so it definitely brought the other vulnerabilities to mind. And there are many of those that I think we might want to talk about as a panel. I turn to you first, Stephanie, for some of your thoughts, and then see if anybody else on the panel wanted to add anything.
Sure, and I'll absolutely say that those health effects that I described for adults, that certainly was not an exhaustive list, right? This was the what has been best described, given that I have a few minutes to talk about everything. But I'll note that even those health effects that I described in adults, they're worse in people with pre-existing conditions, which of course, pre-existing rates of respiratory and heart disease are much higher in the elderly. But in general, that if you age stratify those, they are generally, the risks are higher kind of the older you get as well. And so certainly the elderly are another particularly vulnerable population. I definitely agree with that. If it's okay, Gina, I was also going to just mention right now, the question that was asked earlier about what things health providers can do right now to get prepared for next wildfire season. Super appreciate the responses from Dick and from Ranyee. I'll also say that we have some nice infographics on our PACU webpage about how to protect kids from wildfire smoke. So we've got some info there. Really, there are a lot of people, certainly, the ability to clean your indoor air is an equity issue, as Ranyee was saying. And so it's super important for us to have clean air shelters. But there are a lot of people that have the means to have cleaner indoor air at home and don't realize that they need to do that, and don't know sort of how to prepare for wildfire season. So, to the extent that we as healthcare providers can say to our patients with pre-existing respiratory or cardiovascular conditions, hey, look, do you have, if you have HVAC, do you have a MERV 13 filter in your HVAC system? Do you know what that means, right? Do you have portable air filters? If you don't, can we get you to a place where your indoor air will be cleaner? And if not, can we help you figure out how to find a clean indoor air space when an event happens? Because it's really hard to scramble at the time of an event. So anyways, we've got some infographics. They are focused on children on our webpage because that's my hat, but a lot of the things apply to anybody. And I'll say we're also currently working on a CME course, a continuing medical education course, as part of our Story of Health series on wildfire impacts. And that should be released this summer. So that should be available very soon for healthcare providers who want to get CE, specifically thinking about wildfire preparedness, both for your office and for preparing your patients.
Wow, fantastic resources. Ashley, you had something to add?
Yeah, I just wanted to add for elderly geriatrics and sort of calling on what you were talking about, Gina. So many of the communities where the wildfires occur actually have a lot of older people who need to know evacuation routes. And really importantly, they need to know where they can go with their pets, with their livestock, with the types of things that, we're not contending with in urban areas. And so, some of the work we were doing at Tuolumne County was actually building a resilience center that had ample space for chickens, dogs, cats, cows, horses, right? And these are the things that if we're going to invest in communities to really help everyone, we need to think about why people wouldn't leave. And a lot of the times they won't leave because they just can't take these other family members with them. So, so addressing those issues too ahead of time is incredibly important.
Yes, that was something that was first came to attention during Hurricane Katrina, when many people didn't evacuate because the shelters would not take pets. And I feel like there's better and better approaches to dealing with that issue, but a lot of people in these rural areas do have farm animals, and that is a whole other challenge because large livestock are not easy to quickly move. Any other vulnerable populations that we should be talking about and that haven't been mentioned yet? I think, Dick, if you had, I'm not, there's the issue of using prison inmates for firefighting that Sheri brought up early on in her introductory remarks. And I think that is a really important thing to just flag here, because the risks to the firefighters are dramatic. And Stephanie, I know you've done some work on firefighters. Dick, I know you had some thoughts about that. So I was wondering if one of you could speak to that issue.
Why don't I jump in real fast? When I was state health officer, I made it a chore to actually make sure I visited as many of the prisons as I could. I tried to visit the counties, of course, but people say, well, why are you going to San Quentin? Why are you going to Vacaville? And, it is such a, if you will, reservoir for public health. There are so many interventions in that literally captured population that you can look at, and there are social interventions you can put in place. I will tell you, the prisoners who can get release time are thrilled to be out there working and having some meaningful work. We pay them a pitiful amount, and we don't invest in training them before they end up doing this, and we don't monitor their health very well. I had a pretty unpleasant experience after the spill into the Sacramento River, where in 100-degree heat, mainly men were sent into the river and developed skin rashes without really good workplace safety. But it's also a way that some of these people can get jobs in the firefighting industry. And as you all know, getting out of prison with, $100 in your pocket and not having a place to go and a network to get into is so important. So I think it's a way of knitting together our population rather than marginalizing people. When I tell my students there are more people in California prisons than there are in the University of California, they just think I made it up.
I actually haven't done work directly with firefighters, Gina, although I've helped some students who've been doing firefighter work. I was just going to mention an additional vulnerability, which is, Dick mentioned before the data showing that children's lung function growth has really improved as we've decreased our overall PM burden in this country. And I think, that really suggests the potential for there to be particularly bad effects from wildfires for populations that are already highly exposed, right? This sort of stacking. And we don't really have good data yet on chronic and recurrent wildfire exposures at the levels that these kids are living through, right? But certainly the data from other sources suggest that that's a particular concern. And so that really brings in all of these environmental racism and environmental justice issues that folks have mentioned.
Thank you all. And I want to switch back over to some of the issues that Ashley raised in her talk, because Ashley, you talked quite a bit about the importance of partnering with communities and across sectors to really try to mitigate, to prevent, develop prevention strategies and mitigation strategies. And so can you talk a little bit more about that? And in particular, we got a question from one of the listeners about what's being done to work with tribes and tribal communities, because often these there are tribal lands in the areas that we're talking about.
Yeah, I guess I'll start there and say that, I think there is finally a recognition that Tribes probably have a ton of knowledge in terms of how to manage these landscapes because they have been here for a lot longer than we have. And we do need to be turning to tribal governments, leaders, land managers to learn from their experiences and how to better manage landscapes for fire. So there is finally that recognition, and I think there's a lot of outreach being done there. It's not perfect and still much more needs to be done, but that's one effort. The other is what I mentioned, that people who go to these public meetings on where and when to allow interventions to occur are generally from NGOs, government agencies, groups where they're funded to go to public meetings. But a lot of small NGOs where you might know more of the values of an area, or tribes, just don't have funding or personnel to be able to go to those meetings and advocate for their needs. So the Department of Conservation right now has many millions of dollars for technical capacity and for engagement. And so, we've, through the work I'm doing with the Sierra Nevada Conservancy, we're really advocating for those funds, specifically targeting tribal groups and local nonprofits to make sure that they get an honorarium or some other resources to be able to attend the meetings. And I do think that would help because so many times, the effort is sort of top down. Here's an issue we're having, we need to respond to it, let's get something on the ground, instead of thinking about building solutions and projects from the ground up and really addressing the values and needs of those communities where the impacts are occurring. So that's, one option is really funding those communities. Another, in terms of addressing the cross-sectoral issue, is to really help agencies at all levels of government see themselves as part of the solution, as part of a holistic solution, that they're not, if this cannot be done in a piecemeal approach. It doesn't work. We haven't seen it work. And so really bringing everyone together under this large tent where everyone is focused on community and landscape resilience, and their missions can tie into that, their funding programs, their grants, their communications, they're all much more connected. And I think that, climate has forced that in some ways, environmental justice has forced that in some ways, and we need that more around addressing extreme events that are occurring faster and faster because of climate change. So the more we can kind of coalesce around that visioning, expectation, mission, and grant programs, the better. And we've seen it happen, like I said, with an EJ and with climate, it really has happened. So I think we need to push more on resilience, adaptation, and these kinds of proactive efforts that have to take place.
Can I just add a quick one to
Sure.
Ashley's excellent summary? When we were at CDC, we had really big challenges dealing with the downwinders. They are people that were downwind from the nuclear tests and in the Marshall Islands and elsewhere. And we found that trying to get public input, just asking people to be involved, never worked. We had to actually pay for the training. And in most communities, you can find a wise elder who really would love to spend, I'm not making this up, 3 weeks learning about basic nuclear physics, because you need to know some of the basic language before you can show up and have input. And much of the time, their recommendations were extraordinarily practical about what they needed in terms of a clinic, what they needed in terms of information or data systems, et cetera. And so you're not going to get this unless you pay for it.
It's true. Often there's this idea that the communities will, people from the community will just come and volunteer their time, but that is, in some ways not a thought that helps address the inequities. And one of the communities, I've been doing some work in a farm worker community down in Ventura County, and farm workers, as are all outdoor workers, are particularly exposed to wildfire smoke and are yet another vulnerable population. But there should not be an expectation that they will volunteer their time to be engaged in this issue. There is a need to reimburse their efforts. So it's a good reminder. I also, sorry, Marshall, I think you had something to say, and I also had a question for you. So I'll ask you the question, and then you can talk, address whatever you were thinking as well. But I was struck by the references to mental health effects in Sheri's introduction, and that is definitely something that we see quite a bit in the populations that are affected by wildfires, and it's been worse with COVID. and it is a reminder that we need to think about the mental health impacts. But you're an economist, and how do you think about that? You know, how do you, is there a way to address some of those less tangible health impacts that may be otherwise missed?
Yeah, thanks, Gina. Yeah, as you mentioned, and as Ashley or Stephanie, forget who, Randy mentioned that there is important work already showing, you know, immediate mental health consequences of people in proximity to wildfires. You know, which I think in some senses, you know, it is terrible. But it to me, it only captures potentially part of the puzzle. I mean, if anyone was in California over the, you know, in the fall of 2020, I think all of us suffered to some degree, to very different degrees, but, you know, we're stuck inside during a pandemic. Our kids can't go outside. I mean, people were stressed out all over the place, right? And we don't have good real-time measures of this. What we've seen with other environmental exposures is you can compare these exposures to data on population health and actually do a pretty good job of identifying population health responses to, in this case, changes in climate, something we've worked on. And these effects are surprisingly large. And you see it in ER mental health visits, you see it in suicide rates, unfortunately. And I haven't yet seen those comparable analyses for wildfire. I think it's something that we need to do as our exposure measures get better. So I agree, it's absolutely important. We have already some evidence that it's empirically important, and I think we need this sort of population health view. Others, please, other experts here, please jump in if those papers exist and I just have missed them.
There are some papers out there. There was actually a National Academy of Sciences meeting just a few weeks ago on mental health and the environment. And a lot of these issues were covered. And I think the gist of the meeting, there's a lot of interesting material from that meeting online, but the gist of the meeting is that there is a real need for attention to this space. That you know, when you look at the effects of you know, climate change was one of the issues that was addressed, but when you look at the effects of climate change, the mental health effects may turn out to be among the largest or larger effects across the population, and so it's definitely something to think about. So let's see, I think we're almost out of time, so I want to just give each person a quick moment to offer up a recommendation to anybody who's watching this. What would you suggest that viewers or listeners do to protect themselves, their patients, their community from this growing threat?
Call it out. I'm going to jump in real fast. And one, Ashley, the Academy of Sciences looked at in great depth the issue of impact assessments and felt very strongly, and that committee had on its membership the lawyer who was involved in the original writing of the National Environmental Policy Act, NEPA, and was very clear all along that it was not merely for environment, it was to look at human health, and it was to, just as in a clinical decision, every decision, there are always negatives to anything we recommend as physicians, as well as there are positives, and you're always looking to optimize. And we should be doing the same with NEPA, with the National Environmental Policy Act, and with CEQA. And we don't capture the benefits. Clearly, people don't want to have a controlled burn down upwind from where they live, and yet it may be in February the one thing that you absolutely need to do. Two, we've got to be a lot more involved in urban planning, and to build places like Coffey Park in Santa Rosa with one lousy exit for 5,000 people to get out of there makes absolutely no sense. Three is we need to really get a pipeline of young professionals out there. And right now, the National Institutes of Health, which has gotten $40 billion a year for the last 20 years, is still putting in less than 0.07% into climate. And we need to be supporting the next generation of leaders and the current generation of leaders. And I'll stop there, but I feel very strongly about this one, as you can imagine.
Well, we now have Javier Becerra, heading up the Health and Human Services above the National Institute of Health, and I think he understands climate change and wildfires.
I bet we all do a letter to him tomorrow.
Let's do it. Ashley.
Sure, I'll jump in. So I'll bring up something that we didn't really talk about, and that is development pressure, housing development pressure in areas where, where we're prone to see wildfires. And I just saw Javier Becerra actually sued the city of San Diego for allowing development today in 2 areas that are prone to wildfire. And I think it's just something we really need to be looking at more, right? Like local communities receive property tax benefits from allowing development. But when a wildfire burns, the cost of actually addressing that wildfire and protecting people and responding to that wildfire comes from state and federal coffers. So there's this mismatch of the benefits of allowing development and the costs of what happens after that development goes into places where there's high risks. It's the same thing with, coastal development as well, with sea level rise, hurricanes, other extreme events. So I think we really, we all need to be more involved at our local level, at the city council level, on where development can occur, and ensuring that we really focus more on infill development where things are more secure, and really thinking about that push into the wildland urban interface, and that we're all on the hook for that. It affects all of us when we see those wildfires go in push further and further into the WUI.
The WUI being the wildland urban interface.
Yes, sorry, too many acronyms.
I love it. Stephanie, do you have a thought or set of recommendations for people?
Yeah, sure. I mean, I sort of pitched mine earlier, but
Okay.
so in addition to looking for the infographics and things at our webpage, I'll just say that I think as healthcare providers, we should just get in the habit of remembering to include climate change related health effects, including wildfires, as part of our sort of standard guidance for patients, but particularly for those that we know to be at higher risk. So kids and people with pre-existing respiratory and cardiovascular diseases. I'm actually working with a group right now that's working on trying to get wildfire smoke added as a mention on standard asthma action plans, and working on developing some provider dot phrases that hopefully will be available soon so that people could use those to be able to include in things. But I think, we should just start making that change in our own heads, that when we see patients, this is an important topic to discuss with them, in addition to advocating for the bigger changes, as Ashley and Dick described.
Okay. And Ranyee, do you have some recommendations for people for what they should do?
A couple of quick ones. I think the first one probably is complementary to what Stephanie was raising about getting educated about how to protect yourself during a wildfire event. I think related to that is air quality information, whether it's from low-cost sensors or it's from monitoring stations that our agency runs in the Bay Area. We've got resources on our website to understand what air quality means, and then tied to what you can do to protect yourself. I've seen a lot of people running, wearing a mask. I think we've shifted our understanding of masks over the last year with the pandemic, but I think help to educate people about understanding what air quality means, how it can impact their lives, and then also what to do about it. And then the second thing I think is related to the network of government agencies. And I think healthcare professionals can be an advocate, a very respected voice to help us move forward. We have different priorities. We have different abilities that we're allowed to do, different limits. But I think it's a very unified and well-respected voice within the healthcare professional community to help us move things forward in a way that's focused on health. For example, like zoning decisions. I don't know if anyone had mentioned that, but a lot of the zoning decisions impact air quality as well. So that would be my recommendation.
That's very helpful. And just to add to what you mentioned about masks, I think our thoughts and understanding of masks have evolved with the pandemic, but also The kinds of masks that you might wear for COVID-19 are not protective against wildfire smoke for the most part. I mean, the problem with wildfire smoke is that you really do need N95 level protection in order to really, effectively protect against smoke, or stay indoors if you're able to keep the smoke out.
And there is
yes.
an ongoing National Academies committee actually considering the exact issue of masks and respirators for the general public. So there's ongoing work. I'm part of the committee. There's ongoing work there that there should be information out from that committee sometime next year, 2022.
Okay. And the other thing is, wildfire season may feel far away, but actually we're in the spring now. We're already in a drought year. And this is probably a time to start those conversations, to start thinking about, are you prepared for the wildfire season, and are your patients and the communities prepared? Because there is still some time to make those preparations. Marshall, I think you had some thoughts along those lines.
Yeah, I had a couple. I think the first is that we are going to, we need to welcome good fire. And we need to be able to tolerate some low levels of smoke, perhaps in seasons when we don't normally experience it. But our main tool for fighting wildfire at landscape scale, well, number one is getting a hold of climate change overall. That's not something we can solve in the Bay Area, right? But the other thing we can do is prescribe burn, as was mentioned, or other types of fuels management, of which prescribed burn is one of our most important tools. And that's going to create smoke, right? And we need to not be NIMBYs here and recognize that that's going to be something we need to learn how to tolerate, right? But then to echo the other points that Stephanie and Ranyee made, I mean, helping individuals, and this is important for us as researchers, but also us as individuals, knowing more about our own exposure and developing tools that allow people to understand their own exposure. I was embarrassed to learn about my own infiltration of smoke into my house when I could afford to buy an expensive sensor and track it and estimate statistically over time. It was terrible, right? And I live in a nice house in the suburbs in the Bay Area, right? And so even well-educated folks, I think, are much more exposed than they would expect. And so we need better tools and approaches for understanding and characterizing them.
Yeah, and you mentioned purple air sensors, Marshall. I think that's a nice network because for outdoor sensors, people's sensors are offering data for all of their neighborhood. So you don't necessarily need to have one of your own in order to learn a lot about local air quality conditions. Indoor air is a whole different matter. So that's where we need more available sensors for people. So thank you all so much. That was a very interesting discussion. I appreciate the collective wisdom and knowledge of this great panel. So thanks, everyone.
Yeah, thank you, everyone. That was a fascinating discussion and really excellent questions in the Q&A. And please reach out to us for questions we haven't answered. We will email you responses. And sorry, we couldn't get to all of them. So for concluding remarks, it is my honor to welcome Dr. Talmadge King, who is a perfect person to close us off as Dean of UCSF School of Medicine and Vice Chancellor of Medical Affairs at UCSF. And he is also a renowned pulmonologist and international expert on lung disorders. So as a physician scientist, his research has focused on inflammatory and immunologic lung injury, including pioneering work on interstitial pneumonias. And importantly, under Dr. King's leadership, our School of Medicine has prioritized a commitment to anti-racism, diversity, equity, and inclusion, and also to the reduction of health inequities. And in light of the challenges we face with climate change, this commitment is more important now than ever. Welcome, Dr. King.
So Sheri, thank you so much. And thanks to all of you for this incredibly informative discussion. So last September, like many on the panel, when the fires raged across California, a massive cloud of smoke and fog blocked out the morning sun in my neighborhood. The skies turned this ominous shade of orange and we had to keep the street lights and our home lights on all day. That for me was a wake-up call. I'd never seen anything like it, and I hope to never see it again. As Dean of the UCSF School of Medicine, I'm responsible for working with our faculty educators to continually evolve our curriculum. We've just learned that the climate crisis is a health and equity crisis, and that climate action is a health and equity solution. Health professionals are among the most trusted leaders, making them ideal advocates for the health benefits of climate action. Therefore, ensuring our medical students are prepared to address the most pressing health issues now and in the future, and understanding the causes of those health issues is an imperative. As a pioneer in advancing health worldwide, working in California and other locations on the front lines of climate change, the UCSF School of Medicine has both the honor and the obligation to ensure the health of our communities by strengthening health systems to confront growing climate threats and addressing health inequities that are amplified by changing climate conditions. So at the UCSF School of Medicine, our focus on health equity has shed light on the importance of advocacy for the vulnerable, who are not only disproportionately affected by environmental toxins and climate change in the developing world, but right here in our own backyard. And it is our collective responsibility to look at our system of education, research, care delivery, and patient advocacy to find opportunities to institutionalize and expand our efforts. This task is greater than anyone can tackle alone. We must work together to continue to build and share successes that can be adopted across our systems, state, and our nation. To this end, I'm extremely excited to support the work of this much needed Center for Climate, Health, and Equity led by Sheri Weiser and Ranyee Tiharani. And I thank them so much for developing this symposium today and the ongoing symposium in this area. And I thank everyone for being here today and choosing to be on the front lines of this effort. I look forward to tackling this challenge together and to sharing our progress. So thank you all very much, and thank you very much to the organizers and the presenters for a wonderful opening session in this series. Thank you very much.
Thank you, Talmadge, both for your helpful closing remarks and also for the commitment from the School of Medicine. So I wanted to take a moment to thank Courtney Lyles, Dr. Courtney Lyles, Jessica Fields, Jennifer Monroe-Zakaris, Naomi Byler, Sarah Shear, and Anne-Marie Charlesworth for their excellent contributions to all aspects of this lecture series. We hope that you will all take a minute to complete the brief survey, which we're going to use to inform our upcoming 2 sessions, as well as our future programming. And I just want to remind everyone that our next session on climate change, food security, and migration will be on Thursday, April 15th at 2:30 p.m. And then our last session on climate, racial, and health justice will be on Thursday, May 20th at 2:30 PST. And you could find registration details on the UCSF Population Health and Health Equity website. We very much look forward to seeing you there, and thank you all for coming and for the excellent questions and the discussion.